Hello everyone, welcome back to my channel Pharma Fun for Us. So as you all know, this channel aims to make the study of pharmacy fun and easy. In today's video, we shall learn everything about a medical prescription. How do you read a prescription, all the abbreviations used and all. So hi, I'm Abdunisa Begum. I have done my graduation and post-graduation in pharmacy, and I have also done certain projects in it and also published the papers for the same in International Journal of Pharmacy. As of now, I'm working as a technical and a soft skills trainer. That was all about me. Coming back to today's video, we shall be learning about the prescription, the parts of the prescription, the abbreviations that are used, and we will also see some of the prescriptions for reference, some sample prescriptions. Now, what is a prescription? A prescription, like the name itself suggests, prescript, the script that is being written before giving or dispensing the medication to the patient. That's what prescription means, a medical prescription. Or if you want to go by the definition, it's a physician or a doctor's order for the preparation and administration of a drug or device for a patient. And this order or this what do you say, this prescription is also some instruction for the pharmacist also, how the medication is to be dispensed and in what form and all. We shall learn about it in this video. So there are two types of prescriptions, a handwritten prescription and an e-prescription. Handwritten prescription is quite outdated, but it is the mostly used prescription in our country. But handwritten, there are certain advantages and disadvantages of it as well. So handwritten prescription, the biggest disadvantage is the spelling mistake and the handwriting that has to be understood by the pharmacist or even the patient. So how to dispense and how to take is a problem in a handwritten prescription. Then in e-prescription, this is also evolving and it is taking over handwritten prescriptions in some cities. So e-prescription is much easier to understand. It's a type prescription and easier to understand by the patient as well as the pharmacist. Now, this prescription is divided into mainly three parts, and then there are certain subdivisions. So, first, main three parts are superscription, inscription, and subscription. The superscription contains or consists of the Latin word recipe, or you must have seen the RX symbol that is used. That is what superscription includes. Inscription, it contains the names and quantities of the drugs that have to be consumed by the patient. Coming to subscription, this is actually the instruction to the pharmacist. How many medicines have to be dispensed and in what form or in what number for how many days and all, everything is involved in the subscription part of it. Now, coming to the parts, the subdivisions of the prescription or the steps involved in writing a prescription, you can also say. So there are 6 parts that are there in the prescription. So there are prescriber's information, patient's information, the recipe or the RX, signatura, dispensing instructions, and then the prescriber's signature. Coming to the first one, that is the prescriber's information. This usually is found on the top of the prescription. This includes the information of the doctor. Generally consists of the prescriber's or the doctor's name, the clinic address, and the contact information. All this is included in the first part of it, that is prescriber's information. Prescriber is usually a doctor. That's what it's all about. Then the patient's information. Definitely we need the patient's information, the problems, the complaints that the patient have. So after the prescriber's information is the patient's information. This section will include the patient's full name, age, and date of birth, and also the complaint of the patient. Sometimes the patient's home address will also be mentioned, but that's not a very usual case. It's a very rare case. That's not usually mentioned in the prescription. Then we have recipe or the RX. This should include the medication being prescribed, that has been prescribed, its dose, and the dosage form. Dose is the amount of drug that has to be taken or amount of medicine that has to be taken, and dosage form is in what form the medication is, whether it's a syrup, tablet, capsule, or whatever. For example, if you are prescribed 650 mg of paracetamol, on there will be mentioned the amount, the dose that has to be taken, 650 mg, the name of the medicine, that is paracetamol, and then in what dosage form, if it's a tablet or a syrup. 650 mg of paracetamol tablet or tabs, anything can be mentioned over there. Then we have signature. After the recipe signature is written, this provides the patient with instructions on how to take the medication that is being prescribed. This would include information on how much medication that has to be taken, how do you take it, and how often do you take it. For example, if the patient has to take one 650 mg tablet of acetaminophen every 6 hours, so it can be written as take one tablet by mouth every 6 hours. That is included in the signature. So let us say it can also include, something like if a patient is prescribed 650 mg of acetaminophen every 6 hours when he or she has a headache. In that case, the instructions can be like take one tablet by mouth every 6 hours or as needed for the headache. That can also be a type of prescribing information. Then we have dispensing instruction. This is for the pharmacist. This is not for the patient, this is for the pharmacist. We just saw about the subscription. This part comes in the subscription. So in this dispensing instructions, this lets the pharmacist know how much medication the patient should receive. This includes the amount of medication the patient has to take, in what form it has to be given to the patient. Everything is mentioned in this part. And also this should also include any numbers, to minimize the risk of medication error. Like if the patient has to receive a 1 week medications for anything, like any medication for 1 week, then and the patient has to take it twice. So what can it be written? The number of the medication the tablet that has to be taken, like 28 or whatever it is. That's how it has to be taken. This dispensing instructions includes that. Then we have the prescriber's signature. At the bottom of the prescription, the doctor's name is written and the prescriber's signature. Sometimes it also includes the license number of the doctor. All this has to be mentioned in this. So this is about the parts of the prescription. Then we have the abbreviations. What are the abbreviations used? We see BID, RX, TID. Usually most of the prescriptions include these. So these are all Latin terms that were used some time back, but nowadays not most of the doctors use it. But if there is mention in the prescription, after watching this video you can understand what it is. Like RX is means take thou, or it's a prescription, like you can take the following medicine is what it means. Then BID is bis and die, which means twice a day. TID is tis and die, thrice a day. QID is quid and die, or 4 times a day. So these are the dispensing instructions. And tablet can be abbreviated as tab, syrup abbreviated as SYR, capsule abbreviated as CAP, and then intramuscular or intravenous injections are abbreviated as IM or IV. Intramuscular, the injection that has to be given in the muscle. Intravenous, the medicine or the injection that has to be given in the veins. That is what IV and IM means. Let us see then some prescription examples. Sample of a prescription, you can say. This includes all the parts and this fulfills all the requirements of a prescription, of a proper prescription. The license number, the doctor's or prescriber's information, patient's information is written, includes all superscription, subscription, and inscription parts. Signature is there. Any special instruction that has to be there, there is a column for that as well. The doctor's signature is there. So this is the complete prescription, and it is quite clear because it looks like a typed prescription, e-prescription. This is a sample of a handwritten prescription. This also includes all the information, like you can see the doctor's, the patient's information, the complaint of the patient, RX is there, tablets names, capsules you can see, and for how much time it has to be taken, when it has to be taken, before breakfast it is written, after lunch, everything. And then there is also doctor's signature. This is the complete prescription, and the handwriting, that's what I was saying. In a handwritten prescription, the handwriting, the understanding of the handwriting, and spelling mistakes, that can be a problem. Nevertheless, e-prescriptions are taking over the handwritten prescriptions these days in most of the hospitals. That was about it. Thank you so much for watching the video. If you have any suggestions for me, or if you want me to upload any videos, so feel free to post it in the comment section. Looking forward to any suggestions or feedback from you all. Thank you very much.